Hey, this is Doug Field. Welcome back to this segment of HealthCare Consumerism Radio. I'm here with my co-host, Jonathan Field. And, we're excited about this next segment because, certainly the market's changing dramatically with the evolution of not only the public exchanges, but the private exchange market, and changing up the way benefits are going to be deliverable and accessible. And joining us to really talk about exchanges and specifically ancillary benefits is Terri Wilson, Senior VP with VSP Vision Care, one of the nation's leading vision benefit companies. Terri, good morning.
Good morning, Doug.
How was Sacramento this morning?
It is beautiful here in Northern California.
That's great. Well, nice to have you on the program, for our audience's sake, if you could give them kind of your brief background and then kind of a brief overview on VSP and their niche in the space, I'd appreciate it.
Sure. I am responsible for all business development activities for VSP Vision Care's third-party distribution channels, including private exchanges. VSP, as you indicated, is the largest not-for-profit vision benefit and service company in the U.S. We cover over 60 million members, which means that we cover about 1 in every 6 people that live in the United States.
Excellent. Certainly this market is changing dramatically before our eyes, and in about 30 days or so, the private exchanges will open, and then following that, the public exchanges will open. And we here at the Institute of HealthCare Consumerism, are very engaged across the market with the exchange players and with what's happening and what the perception is in employers. I mean, tell us on your view where you see, kind of look ahead to this fall and what you think is going to happen this fall as it relates to involvement in the private exchange and, specifically private exchange.
We're already seeing a lot of activity. A lot of our partners and the brokers, consultants, health plans are really interested in developing and making sure that they're ready for October 1st and introducing the private exchanges for their employer groups. Talking to a lot of them about including vision care, and there are a lot of reasons that vision care be included on the private exchanges and the public exchanges. And the most important thing to keep in mind is that vision benefits provide a mechanism to help manage chronic diseases and related health care costs. Previously, it was all about risk avoidance, but now it's really about managing the risk better. And employers can do that by selecting an exchange that offers consumer engagement strategies and prevention programs that keep their members healthier, and they can reduce their costs. And vision benefits, they offer the lowest cost preventive services available, and that's through an eye exam. A doctor can detect early symptoms of chronic conditions such as diabetes, hypertension, and high cholesterol. And this early detection allows for early treatment and can help members healthier and reduce health care costs.
Yeah. Is that, we're on the same page there. I'm very involved with transitions and their efforts through Healthy Sight working for you, and I know you're a transitions partner as well. Is the exchange going to make it easier for the acceptance of this vision benefit, vision health message?
I think it will. I think that by today, 75% of the employer groups are offering vision coverage, and when it's offered on a voluntary basis, over 50% of those employees are actually buying the vision insurance. So that tells me that it's really important to make sure that vision is included in the overall exchange offering, to make sure that those employees are offered those choices that really are important to them.
Is it going to be, it's kind of a game changer, is it not, with the private exchanges that choose to provide more of the total benefit experience versus just, let's say a major medical, plan solutions?
I definitely agree that it's a game changer. I think that by giving the employees the ability to really personalize their own benefit design, make sure that they're including those benefits that are really important to them, is going to make them more satisfied and more highly engaged in their treatment.
Mm-hmm. Anything you're doing at VSP specifically to support what your exchange partners are doing beginning this fall to engage their employee consumers?
We are investing heavily in developing really strong decision support tools to make sure that the members make sure that they are including the most important packages for them, to show them why vision is important, to increase that awareness and show them how it can help them with their day-to-day lives and help them reduce their overall health care costs.
Now, what about the public exchanges? Is there a place for VSP in the public exchanges?
Definitely. We are very involved in working with qualified health plans throughout the country. We've developed a very strong pediatric benefit program for the essential health benefits. And then we are also working with the different states in looking at the supplemental programs through the exchanges.
Interesting. And how do you see the changing role of brokers? I mean, you use brokers, correct? Don't you?
Yes, yeah. We use brokers heavily. We are working with a number of brokerage firms with their private exchanges. There is a huge shift from moving with a direct relationship with VSP through these private exchanges, and we really feel that it's up to the client to weigh the pros and cons of what distribution channel that they're working with, if they want to work through the broker, work directly through VSP, or through the exchange. Over the last several years, we've significantly increased the number of ways a consumer can access VSP. We have strategic partners with many health plans, brokerages, dental plans, and other third-party organizations. We also have an individual plan offering available. But our overall philosophy is that we want to enable the customer to really self-select into the channel of their choice, and then support that channel to its fullest to make sure that the customer has a great experience with VSP.
So you're pretty bullish about the future of voluntary benefits, supplemental health, and specifically vision within exchanges.
Most definitely.
Yeah, I would concur with you. There's going to be a world operating outside of exchanges, particularly right now. I mean, We've got our next event December 5th in Las Vegas, and we're pretty excited about that because, the goal of that event is to actually give a real-time look in as to what's happening and what has happened in, private and public exchanges this fall. And, it's my belief, being pretty well connected with employers across the country, that if defined contribution and private exchanges work, as I believe they will, we're going to hear a giant sucking sound of employers jumping on board into the following year. Do you kind of see some of the same?
Yeah, we're seeing the same. I think we're forecasting the same based on what all of the other experts are saying and some of the preliminary results from what people have been able to do in 2013. Right. So we're predicting that there is going to be a significant shift from that direct relationship to the private exchanges.
Yeah. I also believe that the world outside of exchanges, you're going to see a really fast move forward. If I'm an employer and I'm not in the exchanges, I think you're going to see a much faster adoption of full replacement HSA high deductible plans surrounded by well-defined supplemental health, voluntary health, transparency, and wellness solutions. I think sets itself up well for a VSP product as well.
I like to hear that.
What should employers, what are you talking to? I mean, let's say you got an employer, you have many employer clients, but let's say your employer client is going to an exchange and you're not part of the exchange. How are you addressing those kind of situations?
So we think it's important that as employers are thinking about the exchanges, that they really understand the rules and participation requirements, because each of the exchanges are unique and they have their own requirements. Some have that all or nothing policy where they require you to offer all lines of coverage on their platform, and others give you the choice where maybe you have to have medical, but you can still go direct on your ancillary products. So I think it's important for employers to really take a look at that and what the value propositions are for, having everything on the exchange versus some things on the exchange and others direct. So we would, definitely, if we're not on that exchange, we would definitely like the employer to stay direct with us. But we are in negotiations with several exchanges because we really do want it to be the employer's decision on how what channel they choose to buy from.
Excellent. Any partnerships with exchanges that you can publicly talk about right now that you're working with?
Sure. We are on the Aon Hewitt platform. We were on there for their 2013 launch, and we're really excited for the growth they've had for 2014. We are also on the Buck, the Right Opt Exchange. We're Mercer Marketplace partners, as well as Towers Watson for the big national players. And then we're in negotiations with a lot of the regional or the smaller players that are focusing more on the small to mid-market.
Well, excellent, Terri. Listen, we've got about a minute to go, and I really appreciate your time and want to give you a chance to kind of provide our audience with a couple key takeaways you'd like to leave them with.
Sure. As you mentioned in the beginning, it's a pretty complex world right now, lots of confusion, and just, a lot of questions regarding PPACA, public exchanges and private exchanges. But I think it's important for employers just to keep in mind that providing a vision benefit is one of the most cost-effective ways to help manage the health of your employees. So regardless of, again, what delivery system they choose, I really encourage them to consider having vision care as part of their benefit solution.
All right, Terri, thank you so much for joining us. You have a great weekend. And
thank you very much, Doug.
Yeah, and please join us in Las Vegas. I'd love to see you out in Las Vegas.
Great.
And
thank you.
You have a great weekend. And to our
You
audience,
too.
stay
Bye-bye.
tuned for the next segment.